And welcome to the Kevin Dunn Show. Hope you're having a wonderful day. We're glad that you tuned in to join us today. Of course, this month is October, and a lot of us know that October is Breast Cancer Awareness Month. We have a special guest today, a special oncologist in the house, Dr. Wassim Mchayleh. And when we come back from the commercial break, we're going to be sharing with you why we're wearing our pink, and Dr. Mchayleh is going to educate you on breast cancer.
The Kevin Dunn Show, brought to you in part by Rogers Barbecue, LaGrange, Georgia. Rogers Barbecue in LaGrange has been locally owned and operated since 1945. They have daily lunch specials for only $6.62, and that includes your drink and dessert. Tuesday nights from 5 to close is all-you-can-eat ribs. Thursday, Rogers has all-you-can-eat catfish, which, along with their stew, is famous throughout the region, and they proudly serve only U.S. farm-raised catfish. Dine in or use their convenient drive-thru, Monday through Saturday, 11 a.m. to 9 p.m. at 117 New Franklin Road in LaGrange. Come join the crowd at Rogers Barbecue.
If you've got a big lawn, you need a big time mower. You need an X-Mark. With an X-Mark, you'll get a better cut faster and a mower that may be the last one you'll ever need to buy. So if you want your lawn to look like a pro maintained it, use what the pros use. X-Mark. Purchase 2-to-1 over the next best-selling brand by landscape professionals. For more information, visit your local X-Mark dealer or xmark.com.
Life's dirty, play clean. SOS Cleaners, locally owned and operated in LaGrange with over 54 years of experience, is a full-service dry cleaners, and all cleaning is done on premises using environmentally friendly cleaning processes and practices. SOS Cleaners specializes in shirt laundry, alterations, furs and leather, formals, odor removal, wedding gown preservation, and fire restoration. We have a fully functional drive-through, and same-day service is available upon request. Also, give them a call to find out their weekly specials. Life's dirty, play clean. And welcome back to the Kevin Dunn Show. Our special guest today is Dr. Wassim Mchayleh. Dr. Mchayleh, how are you doing?
I'm doing well. How are you, Kevin?
I'm doing fine. I gave you a fancy word before we came back, oncologist. Really, he's just a cancer specialist, and he specializes in dealing with multiple different types of cancer. But this month is the month of October. We're in the Breast Cancer Awareness Month, and Dr. Mchayleh is here to talk about breast cancer. As you can see, he's in his pink. I'm in my pink, and I'm in my real Men Wear Pink band. Let's get started right in the interview. Dr. Mchayleh, can you just tell us what is breast cancer?
Breast cancer is a type of cancer that happens in the glands of the breast. You know, breast is an organ like any other organ in our body, and it has its function of producing milk in pregnant women. So those glands could have some abnormal growth, a cancer growth that leads to breast cancer.
And it's so prevalent in our society, and it's all across the board now. It's more common in black women, white women. What about people in other countries? Is it real common with them as well, women with them?
Well, you know, breast cancer is a very common type of cancer. It is the #1 cancer in women. 1 in 7 to 8 women have breast cancer, risk of breast cancer in their lifetime. It is the second leading cause of death from cancer in women, lung being the first. So it is a very common cancer.
So you would say on average, out of all of the cancers that you treat, and I know you treat so many different patients, I might not even should be asking you this, but would you say that you see more women with breast cancer more than any other kind of cancers?
I would say I see an equal number of breast cancers and lung cancer. Lung cancer being a very prevalent cancer as well in men. If we're talking about women and men together, because I treat both sexes, I would say it's an equal number between breast and lung cancer.
Okay. Now, Dr. Mchayleh, what are the different types of breast cancer?
There are different types of breast cancer that depends on, you know, the pathology, the characteristics of the breast cancer, but there are some markers that we study when somebody is diagnosed with breast cancer to characterize the breast cancer. So we check the hormone receptors, we check a receptor called HER2, and when depending on how these receptors are, we characterize the breast cancer. For example, you may have heard of hormone-positive breast cancer, and those are the ones that express the hormone receptors. You may have heard of the HER2-positive breast cancer, and those are the ones who express the HER2. And you may have heard of the triple-negative breast cancer, where all three receptors are negative.
Man, that is a lot. Do you learn a lot on your own, or just the research just changes from year to year? How do you stay on top of all these different types of breast cancer?
Well, this is one of the reasons I am in the field, because this is a very rapidly changing field with a lot of research and a lot of intensity in it, and you have to stay on top, otherwise you'll be behind. There's new treatments and new discoveries every day, and you have to be on top for your patients.
Okay, all right. Now, out of all the different types of cancers that are in our society, it seems as if breast cancer awareness, breast cancer, gets the most attention. Can you tell our viewing audience, well, why do you think that's so?
Well, I think, and you are correct. I was in a meeting lately, and they were discussing the funds for research per type of cancer, and not surprisingly, you see that breast cancer had double the amount of money for research compared to any other type of cancer. Lung being the most common, but breast had double the money. And I think it's because it affects more women, and women are after their cause, and I'm proud of them, and I wish everybody does the same hard work like they do and we do for them, to get more money into research and get more progress.
So it goes back to the women.
I think so. I think a lot of things go back to the women.
The women are smarter and more mature than men, so I guess this is a perfect example of that.
I can't disagree with you.
Okay. Now, Dr. Mchayleh, tell us, what are some of the risk factors that are involved with breast cancer?
Well, there are many risk factors. It's not like lung cancer where you have a direct association between a risk factor like smoking and lung cancer. In breast cancer, we know that women who never had children are at higher risk. The first pregnancy being at an older age is a risk factor. Alcohol could be a risk factor. Obesity is a risk factor and affects the survival. And hormone exposure, in addition to the genetic predisposition, and the most important, which is a strong family history.
So you're saying that women who do not have childbirth, they are at higher risk?
It increases the risk slightly.
And that's because of their body not going through the changes that...
The science behind that is that when they are pregnant, the hormones in their body change, and during the pregnancy they have more progesterone and less estrogen, which is involved in breast cancer development and feeding those cancer cells. So, this 9 months where they have less estrogen is probably the reason. Nobody could understand exactly why, but this is one explanation.
And Dr. Mchayleh, I know life is not fair, but this seems so unfair that this happens. And that's altogether another different subject, but it just seems like you would be in a better position to not have it if you didn't have a child.
Again, it's a small risk.
It's a small risk.
Small risk factors, not having a child doesn't mean you're going to have breast cancer.
Okay,
and
exactly.
Having children does not protect you from breast cancer. These are observations that were found, and when we try to study cancer, we try to find what increases your risk, what decreases your risk, trying to understand cancer, and those have been going on for a long time.
So cancer is just a big mystery.
It is.
And that's what intrigues you to study it, pretty much.
That's correct.
Okay.
It's the emperor of all maladies, if you've read the book.
The emperor of all maladies?
Mm-hmm.
Okay.
Malady is disease in French.
Okay.
So.
Okay. All right. Now, Dr. Mchayleh, a lot of men, and I know we're dealing with the women, but a lot of men do not know that this can actually happen with them. So you said earlier that men can get diagnosed with breast cancer too. Tell us a little bit about that?
Men can get breast cancer as well. You know, we have breasts, even though you know, there's less breast tissue in men, but they can still get breast cancer. I see quite a bit of breast cancer in men. The risk factors, actually the risk of having breast cancer in men increases with age as they grow older. And the other risk factor is the genetic predisposition. You know, there are some genes that are associated with breast cancer, the BRCA gene, BRCA1 and BRCA2, and having those genes, carrying them or inheriting them from their parents increases the risk of having breast cancer.
So it's just like everything passed down. Diabetes, high cholesterol, hypertension gets passed down through generations. The same thing can take place with this as well.
But in this case, you have a gene that is identified. So you could test and check for that gene, and if you have it, then you could test the rest of the family members.
Now, with that gene being tested and it comes back negative, is that to say that you'll never have it, or you are low risk from having it?
Well, you don't test for the gene unless you have it or you have a strong family history. The gene, you know, the genetic type of breast cancer counts of about 5% or 10% of all breast cancers in men and women. So those genes could be in men or women. And usually a woman who has a BRCA1 gene, for example, has a risk of having breast cancer of about 80 to 90% in her lifetime. She almost knows for sure that if she's going to live long enough, she's going to have breast cancer. So carrying those genes changes everything. Now, not having the gene doesn't mean you're not going to have breast cancer, because there are genes that we haven't discovered yet, and there are you know, familial forms of breast cancer. So, you know, a woman who has breast cancer, there is an increased risk of breast cancer in her sisters and in her daughters, even without the gene.
Wow, that's very interesting. Dr. Mchayleh, we're going to have to pause and take a quick commercial break. And when we come back from the commercial break, we're going to be talking about how many different stages are there involved with breast cancer. More of Dr. Wassim Mchayleh when we come back from the commercial break.
Rogers Barbecue in LaGrange has been locally owned and operated since 1945. They have daily lunch specials for only $6.62, and that includes your drink and dessert. Tuesday nights from 5 to close is all-you-can-eat ribs. Thursday, Rogers has all-you-can-eat catfish, which, along with their stew, is famous throughout the region, and they proudly serve only U.S. farm-raised catfish. Dine in or use their convenient drive-thru, Monday through Saturday, 11 a.m. to 9 p.m. at 117 New Franklin Road in LaGrange. Come join the crowd at Rogers Barbecue.
Coldwell Banker Spinks Brown Duran Realtors is the market leader in residential and commercial sales. With over 40 years in the community and 2 offices located in LaGrange and West Point, our knowledgeable and professional sales agents can assist you in both Georgia and Alabama. Whether purchasing or selling a home, commercial property, or land, Coldwell Banker Spinks Brown Duran Realtors is the obvious choice to serve you. View our listings online at www.spinksbrownduran.com and contact us today so we can help with all of your real estate needs.
Welcome to America's Mattress, the area's largest mattress showroom within 50 miles, and it's located right here on the Parkway in LaGrange, Georgia. Here at America's Mattress, we have 7 different iComfort memory foam mattresses on display, 7 different iSeries hybrids on display, 7 different Perfect Sleepers on display, and 17 other models by Serta on display. We also have 6 different adjustable bases on display. America's Mattress carries the Dr. Green that is designed for people with back problems. America's Mattress also carries both mattresses that our Consumer Report recommends as the best innerspring and best memory foam. So for the best mattresses at the lowest prices, shop America's Mattress here in LaGrange, Georgia on the Lafayette Parkway.
And welcome back to the Kevin Dunn Show. Just in case you're just joining us, Dr. Wassim Mchayleh, we're talking about breast cancer. This is October, the month of breast cancer awareness. So Dr. Mchayleh, I want to ask you now, how many stages are there as it relates to breast cancer? Or how many can you talk about? It's probably several, but how many stages?
Breast cancer is like many other cancers. It has 4 stages.
4 stages, okay.
1 being the earliest and stage 4 being the latest. Stage 1 is an early cancer with a small tumor. Stage 2 and stage 3 is a larger tumor which started to spread and may have gone to the lymph nodes. And a stage 4 cancer is a cancer that had spread elsewhere to other organs like the liver or the bones or the brain, which are common organs where breast cancer tends to go. The staging system of breast cancer is very important because the prognosis depends on the stage. We know very well that women with a stage 1 breast cancer have a chance of cure of 90% or above, somewhere around that number. And we know that as the stages goes up, the survival goes down and the chances of cure go down.
Okay. So just 4 stages, with one being
The earliest.
curable. And that's pretty much the difference. The earlier stages are the more curable stages, and the later stages
Are the
are
less
maintained.
curable.
You just have to just maintain that over the years, pretty
Right.
much. Okay, all right. Can you tell us what determines the different stages, as far as, or is just that when you actually check the women out?
So usually when a woman is diagnosed with breast cancer, we run some tests to try to identify whether the cancer had gone to the lymph nodes, whether the size of the cancer, and whether the cancer had gone to other organs, such as a PET scan. Sometimes we run an MRI of the brain. And depending on the size of the tumor, depending on whether there's lymph nodes involved, and depending on whether the cancer had gone anywhere, all these factors would predict the stage of the cancer.
Now, Dr. Mchayleh, if a woman has stage 1 breast cancer and she does nothing about it, say for 2 or 3 years, and I know this is a hypothetical question, nothing about it for 2 or 3 years, will it continue to stay stage 1, or it's definitely going to go into stage 2, 3, or 4?
It really depends on the characteristics of the breast cancer.
Okay.
There are some, and honestly, this is a great question. Nobody knows the answer for this, because our tendency is, if we find a stage 1 breast cancer, we're going to act on it. We don't leave it and watch it. So we don't know, but we know though that there is a subset of cancers that may behave in a less aggressive and slow growing way. Now, when you have cancer, you're going to do something, so we don't know. But not every stage 1 cancer is treated the same. We
Okay.
do have some new testing, like gene testing, to identify how aggressive the cancer is, whether he needs to get chemotherapy or not, and these kind of things.
Okay. With all of your wisdom and medical experience, what are some determining factors that decides how you would treat the breast cancer? Or does it just relates to the stages, or well, just what do you decide on treating?
Well, there are many factors. It depends on the patient. It depends on the age. It depends on the medical problems. It depends on the stage. It depends on the type of cancer. It depends on the hormone status. It depends on the HER2 status that we talked about earlier. All these are taken into consideration to draw a treatment plan. We don't treat them all the same. Each patient is treated differently, and we take it as a whole case, as a whole situation. We study the patient, her case, her tumor, her cancer, and then we come up with a treatment plan.
Okay. Now, with breast cancer just being, I say all in our face, because you just see it everywhere, are more women starting to get mammograms more regularly?
I
What do you
hope
think?
so. This is why we're on TV. This is why we do our campaign every year. This is why we talk about it. We know that this is a cancer that can be caught with a simple test, which is a mammogram. We urge women at age 40 to have their mammograms, because it's a very inexpensive, easy test that can save their lives. The test can detect the cancer at an early stage. It decreases the mortality and increases the survival from this cancer, even if they have the cancer. But they could still get cured and get it treated.
Okay, all right. Now, is there anything that women can do to maybe lower their chances of getting breast cancer?
There are some lifestyle changes that
Okay.
I would recommend, not only to women but to everybody. Regular exercises, healthy diet, less alcohol. Please don't smoke. And the other thing is to avoid hormones after the menopause. So I think these are, good lifestyle changes.
Okay. Now, can lumps or breast cancer be prevalent in someone's body and not show up on a mammogram?
Definitely, not every lump is cancer, though. Let's
Okay.
start there. There are a lot of benign diseases in the breast. So not every time a woman feels a lump in her breast, that means she's going to have cancer. But sometimes some cancers are not felt on exam, and they are detected on the mammogram. Now we know that there are features that we see on the mammogram that look suspicious and make us suspect breast cancer. So depending on what they see and the features on the mammogram, if this level of suspicion is high, we proceed with a biopsy. Sometimes we know it's not breast cancer with the mammogram itself, and we don't proceed further.
Okay. Is there a big difference between a mammogram and an X-ray?
The mammogram is a form of an X-ray that's directed to the breast.
So just directed to the breast?
Yes, there are other ways of screening for breast cancer. An MRI of the breast is another test we could do, and we usually do it for women with dense breasts or women who have a high risk. And women with high risk are women who have a risk of 15 to 20% of developing breast cancer. And those include women with the mutations I talked about earlier, the BRCA mutation. So in these women, we recommend performing MRIs to get more accuracy in the screening process.
Okay. Now you just said a lump, not necessarily means that it's breast cancer. Do you have any percentages? Do you know what percentages of lumps being found that are not breast cancer? You probably have to do a test or a study on that.
I don't think there is because it really depends. Many women when they're young, they have fibrocystic breasts and they may have lumps which are nothing. So it really depends on the age. It really depends on the shape and the characteristics on the mammogram.
Okay, so basically you're saying a lot of times age depends on your treatment. So if someone is older and they've developed breast cancer, you will be more cautious with your treatments. Is that correct?
You'll be more cautious with your tests. So if an elderly female have a lump in her breast that appeared and is increasing in size, that makes me worry more than a 20-year-old girl who felt a lump in her breast about breast cancer. Of course, the suspicion level is much higher in the elderly. We know that the risk of cancer goes up as we get older.
Wow. Now, Dr. Mchayleh, if there's a lady or man that is watching the show right now and they've discovered a lump or whatnot, and they are scared to go to the doctor, what would your message be to her if she's afraid to go to the doctor?
I would say, I understand being scared, but I think the best way to help is by going to the doctor, getting it checked, because if this is breast cancer, you need it treated, and if it's not breast cancer, you want to know about it. Breast cancer is cured in more than 80% of patients. So this is a very highly treatable and curable disease, and it should not be ignored. I don't think we are at an age where we should see breast tumors growing through the breast and ignored. I think we're past that.
Now, if there's breast cancer in one breast, what are the odds or chances that it's in the other breast?
Again, it all depends on the risk factors. For example, women who have the genetic mutation, the BRCA mutation, they have a higher risk of having bilateral breast cancers. So they may have it on both sides. Having breast cancer is a risk factor of having breast cancer. So what I always tell my patients is, if you have it on one side, that means you may have it on the other side. And this is why even when they have breast cancers and they're treated, we watch them and continue to do mammograms yearly and watch the other side as well. Having breast cancer doesn't mean you're not going to have it again.
Okay. And I know women may know this too, but then again, there may be a few who don't. If you're over age 40 and you don't have a family history of cancer, how often do you need to get mammograms?
So there are clear guidelines on the mammogram, and the different societies have sent different recommendations. But what I would say is at the age 40, we need to have at least a baseline mammogram and then have a mammogram every year. Some people say every 2 years until the age of 50, but after 50, definitely every year.
Every year. Now, if you don't have breast cancer in your family, and I know you said 20s or whatnot, but how often would you recommend that someone without a history get mammograms?
It's the same recommendation.
Oh, same recommendation?
Every year, yes.
Every year, okay. All right, with all the money that's given to research and awareness and all the attention that breast cancer has gotten, in your opinion, why do you think there has not been a cure for breast cancer?
Well, I can't agree with this. I think there's a lot of progress in breast cancer. A lot of cases are cured. I think the money has led to a lot of innovation and a lot of treatments. I can tell you that in the last few years there have been at least 5 or 6 new therapies in breast cancer that never existed before. New discoveries, new pathways that we're targeting in the treatment of breast cancer. So I honestly think that we have made so much progress. And as I said, you know, if you take all cases, about 80% of the breast cancers, all comers, are cured. So I think that's a big achievement. But even patients who have stage 4 and cannot be cured, now with the new treatments, they could be treated as a chronic disease and live years on treatment, but continue to live a reasonable life and be with their families. And I'm very hopeful with all those new treatments and new progresses that we continue to go in the same direction and we achieve a 100% cure in the next few years.
And with that being said, I'm pretty sure the medications, the pharmaceuticals are steadily changing as well.
Absolutely. A lot of changes, a lot of new treatments. So this is why we try to stay up to date and keep up, because every few months there's a new treatment and new hope.
New hope. Okay. All right. Well, Dr. Mchayleh, we thank you for taking time out to be a guest on Kevin Dunn's show to educate our viewing audience about breast cancer. I know that they've been impacted. And ladies, I hope you have been inspired to get your mammograms regularly, and as Dr. Mchayleh has shared with you. And once again, if there's a topic that you would like to see discussed on the Kevin Dunn Show, please email us at thekevindunnshow@wjcntv.com. We thank you so much for joining us. Hope you have a great day.